Yeah, I think we're live. So, welcome, Ali. You're back. It's been about 6 weeks since we had the craziness. How are you doing?
It, I'm not doing too bad. I'm not sure if you still emotionally recovered from the the ordeal
Yeah,
that
yeah.
was.
It was crazy, wasn't it? We had 75 guests over the 25 and
Yeah,
a half hours. It wasn't even 24 hours in the end. Um, and
yeah.
how much did we raise in the end? We had only last week. I got another person donate, so we actually ended up with I think it was 4,500. So done pretty well there.
Yes, I've got the total here. 4,526.25. Not
Yeah.
bad.
What's the money going towards for the guys who missed it?
So the main target of this is at RCF we do fundraise for different things. We do welfare, we do prevention, we do dental as well, and we do like relief if there's an incident. Say for example there was that fire in the
Yeah,
Greek camp. So we're looking at how we can help there, working with some charities locally. So the main target of the podcast was dental.
yeah, sure.
So essentially, what it's been doing, it's been helping us to maintain the funds for the camp. We've been buying PPE equipment, supplies. We still need antibiotics. We still need all of our normal dental supplies like anesthetic, filling material, extraction forceps. We still need to buy petrol to run the generator for the electricity at the clinic. So all the usual
Yeah,
things. I'm sure, as all of us dentists know, it's usual, but it's 10 times more difficult because we have to deal with all of the personal protection equipment, working out management, making things as COVID safe as possible.
mm,
And I'm sure everyone can appreciate, even in the UK, where all the dentists are struggling. So it's a lot harder in that campsite. So it's been basically trying to manage the COVID as well as possible while trying to minimize the interruption to the care for the refugees. That's really what the money's been going towards.
yeah. How has COVID kind of changed things? Are you seeing like everywhere else less and less patients, or have you worked out a way to
Yeah,
do
no,
that?
there's no way around it. We're unfortunately seeing less patients than we were before. There was a period of time where the NGOs at the camp had basically just put a complete restriction, a bit of a
Mm,
lockdown. That's eased a little bit. We've brought in some new policies. We've brought in full equipment, protective gear, the visors, and the masks. So now we're starting to see a few more patients. We're still limiting the treatments that we're doing, same as we're doing in the
right.
UK. We have to be mindful of AGPs, of fallow time. So we're trying to focus more on extractions and simple dressings, avoiding using the hand pieces as much as possible. But generally, we're starting to come a little bit more back up to speed. But we're playing it, day by day, seeing what the R levels in the camp, seeing the infection
Yeah,
rates, and we have to follow the main people at the camp and their advice.
yeah, for sure. Yeah.
Um, but for the time being, we're trying to maintain the emergencies as much as possible.
Is it almost? Is there any way that it's maybe easier in that you have situations where you're open air, like are you doing anything outside to kind of minimize the risks and stuff like that, or is it all indoors, same as here?
Well, we have an indoor. It's a bamboo structure, so the ventilation is going to be
Yeah,
better, for sure. But because of there's with any procedure, we've got to consider privacy and confidentiality. So we do have the clinic set up behind screen
yeah,
doors. So it wouldn't be like an open air thing. So we do have to bear that in mind. But this way, it's easier to manage patient flow. It's easier to manage the cross infection. And again, like we said, confidentiality and just a nice environment, a more clinical environment for patients to be treated in. We think that's very important for all of our patients, no matter where they're being treated.
yeah. I think that's true. It's just one of those things. I was thinking, well, actually, if you can literally set up an open air with no roof or something, you might be able to get away
Mm.
with some of the fallow time restrictions, whereas you can't do it here. But yeah,
But if it's that open air, what are you going to do with your handpiece?
yeah, I hadn't thought that far ahead. I'm just, spitballing ideas in the middle of nowhere. Just
That's it. I mean, I feel like there's been periods of time where it's been literally that's the facilities that we've had, but now we've managed to establish something a little bit more
yeah, yeah,
secure. Um, the main negative that we're having is we would do regular delegations of UK dentists to go over and supplement our Bangladeshi dentists who are hired at the clinic to do prevention, to do like extraction clinics. We get people with good experience, oral surgery, to try and deal with some more advanced cases. We'd often have doctors who would come with us as an attachment, and we would do referral clinics. So we're struggling to run that at the minute because obviously, look, with travel restrictions,
Yeah.
one, we've got to consider the safety of our volunteers who are going out, and that's always our number one priority, is making sure anyone that we're taking with us is logistically looked after and is safe. And for the time being, it's difficult. The second problem is that even if we do go and it's safe for them, when we come back, everyone has to self-isolate for 2 weeks. So it's just become a bit of a logistical nightmare. I don't think there's any way around it for anybody at the minute. Because one, if you're going to go for at least 2 weeks, and then you're going to have to take another 2 weeks off work to come back.
Mm.
So it's just unfortunately not feasible for most healthcare professionals to do
Yeah,
that.
it's a difficult situation that's kind of been there, and a lot of the trouble is, as we know, people are anti-maskers is an actual thing. So I've seen
Mm,
videos on Twitter recently of people storming a Target in the States and screaming about no masks and all kinds of crazy stuff. So I
yeah,
mean, it's not helping, because we could probably go back to a little bit more normality if people just go, you know what, we'll wear the mask, and then we can do
yeah,
everything we want. I saw this
yeah.
great meme.
I mean, from the data I'm seeing recently, it does seem like the R rate's starting to shoot up a little bit. I'm hoping it levels off a bit before Christmas, but I don't know. I'm in Preston, which is currently in local
Yeah.
lockdown, so it's we got to see how it is. I think that's all we can do. I think having a positive attitude is very important, and I think for me, a lot of people need to take responsibility for their health
Mm,
and responsibility for their actions. Um, so if you're going to be out, try and wear your mask. If you're sensible about it, that's
yeah.
good. I think it was only 2 days ago that they brought in the restrictions on meeting socially a maximum of 6 people as well.
Yeah. It's not been long since they did that, has it? I don't know
Mhm.
if it's going to make much of a difference, though. I do wonder.
Well, yeah, because some of the rules, like you can still go to the gym, you can still go to a restaurant, and there's lots of people there, and I'm not convinced about the total COVID safety. But then there's the flip side of, if you even do swaddle yourself completely, is it still preventable? You still need to go to the shops. It's one of those where you got to consider the financial impact, the mental health, the economic. Like there's a lot of different things. I think for me the biggest problem is I finding that like cancer referrals are taking a lot longer. The patient's waiting for routine treatment, which is getting
Yeah.
worse. Like my sedation list, my referrals are like through the roof. It's so I think there's more of a bigger picture as well. So I don't know if it's as clear cut as lock down 2 weeks and then it's done. Because I think if everybody did it and it was just unbelievably strict, we might be able to get it under control if it was like 2, 3 weeks. But then what's happening with the economy, the routine stuff, what happened to those people? So
Yeah, I've heard some really strange stories about kind of 2-week referrals where nothing's getting accepted, even though it's like
yeah,
obviously needs to be seen. Like there's stuff like, well, I can't do anything about it because you're GDP.
yeah,
So
yeah,
it is a little bit worrying there, in that what are they actually doing, and no one seems to have a clear answer with some of these things. But I think you're right. The whole mask thing. I think if people just went for it, and similar to Singapore and places like that, I'm pretty sure you'd be
mhm,
in a much better situation than we are, because uh,
yeah.
they're kind of used to it in a way, because they had the initial SARS outbreak, didn't they?
Yes, yeah. So that they're kind of a bit more prepared for what to do. I think my personal favorite though is when the patient comes in and they've got the mask here, so over their mouth, not on the nose. They go, it's really difficult wearing these. And you just look at them and you're wearing like a respirator, a mask over the respirator, you got a visor, you got a gown, you got a surgical hat, and you just look at them like,
You're having a laugh.
come on, mate, come on. He goes, oh, I don't know how you do it. And you're like, I know.
Yeah, there was that meme where I saw earlier actually, and they were saying, "Oh yeah, I'd do anything for my country," and then how about wear a mask? And there's just people having a fit.
I know,
It's
yeah.
literally the thing, isn't it? It's like, yeah, it's all talk. People are all talk. Um, but yeah, I really want to know a bit more about the early days when you and your sister Kieran were, going over
Mhm.
to Calais, and then did you ever envisage actually being at the head of something where you know it's going to be going sending people to Greece, sending people to Bangladesh, sending and all these dentists from across the world are kind of involved.
Definitely not. It was never it was never that ambitious. It was literally, let's do our best to help and see how it is. And as these things are wont to do, they kind of just snowballed from
Mm.
there. And it became bigger and bigger. And it's just been through the unbelievable support of just the general community. Healthcare professionals are all awesome. People would just come in and be like, "Oh, we thought of doing this. This is a way to grow it," and it's just kind of organically got to the point where it is now. There's been targeted approaches as well, and there's been a lot of hard work behind the
Yeah,
scenes and a lot of Excel spreadsheets. I'll put it that way, and planning and meeting logs and
I'm having
yeah,
flashbacks to that sheet we had. Do you know where we were trying to put people
podcast.
in the
But
slots?
yeah,
Oh god, I remember that meeting. Me,
yeah,
you, and were you in the meeting with Kieran? Because I'd obviously spoke to um, the now married couple about getting myself involved with RCF. And I think they were a little bit
yeah.
preoccupied with the whole wedding coming up and stuff, which is fair play. I mean, I would be too. So I think some of the information hadn't got to Kieran about what was going on. So I'd just gone full steam ahead. I'm booking people in left, right, center,
Booked
booked
everyone in.
everything in, and
Yeah,
then Kieran's like, "Yo, you need to actually talk about the charity." I was like, "Yeah, we'll talk about it." And then she's like,
yeah. Don't worry about it.
she's like, no,
Be
no, you
fine,
need to
be fine.
explain to them about the charity. He's like, oh, yeah, okay. I was like, crap, I booked in like singing dentist,
It
and I
worked.
booked in like.
No, but it worked out. It worked out in the end, though.
To
It
be
was
honest,
good.
I had the
I
spiel down
enjoyed
by
my
the end.
little
I had the spiel
cameos.
down by the end.
Yeah, right. I was tired and I was just popping in and out, having like naps in between playing some Call of Duty. You were like straight
Do you know
through.
what it was? I mean, you play Call of Duty, so have you ever played a game where
Yeah,
it's like you level up?
yeah, right.
That's what it felt like to me, where I was okay. Now we're at the next level because we've got £1,500 in there, and I need to I need to play the game a bit harder so I can get to the next level. It became like a computer
We
game.
never reached the final boss of the head shaved and the ginger beard.
Still here.
It made it through. It made it through.
Yeah, it's still here. So you guys, we actually failed. Sorry. um, yeah. So I mean, obviously, we managed to get through 25 and a half hours, but yeah, I actually can't remember at least half of what went down. I have no idea what I was
But
saying.
I remember Shiraz was a good one when I was on. He was quite a funny guy.
Yeah, Shiraz is good
He's
value. He always has something to say to me though. That's the thing. Is like puts me on the spot,
he's
puts me
proper.
right on the spot. But
But he made us a promise, so he's on my mental list. Whenever things are back up and running, I'm going to be knocking on his
oh, you
door
got to do it. Yeah, it's got to be done.
to get involved. And then I'm waiting for your videography to take off. That's what I'm waiting for. We need a sick videographer to come with us on one of our trips.
Have you seen the recent stuff
So
me and my friend have been doing? The actual photography. That's the first step.
I've seen the I've seen you. I've seen your new modeling contract is coming up
That's
soon.
But the thing is, obviously you got to be clever and socially distant and all that sort of stuff. So we said, well, right, I'm going to go and meet some of my friends because I'd bet that was the first time I've left the house. Like the first time I'd left the house for anything other than the shop, going to pick up things from work,
Yeah.
or yeah, that's it. That's the first time I've left the house to actually do something. So I think I played football once, five-a-side, but yeah, so that was kind of like my first outing. So I was thinking, well, you don't want to go to crowded places, so we said, oh, we'll do a walk, and we'll walk around Manchester and take photos. And there was a camera.
Manchester, you're on my ends.
Yeah, we're not because I'm Halifax and he was Rochdale, so we're both pretty close to Manchester. It took me about 40 minutes to get in.
Not fun.
Yeah, we picked the wrong day because there was a police scare that day, but I mean it was fine because we were just walking around and then we found these little alleyways and stuff. I'm like, okay, we can make this look good, and it's kind of like you try and find something which looks at the crappiest possible place and like make it look interesting, like some random steps.
Yeah.
All right, I'm gonna sit on the steps.
Yeah, I liked it. I like the picture composition. And there's some good textures as well. Were you using the work camera?
Yeah, that's the microscope camera.
Oh, best
Yeah,
camera.
that's the work camera is actually a Nikon, which I've got the
Yeah.
Sigma, the Sigma lens for
Mm.
that one.
Oh, the
Yeah,
macro. That's yeah,
and then I
that one.
have
I've got.
this is an incredible lens. By the way, guys, if you're
Is it the
this
150?
is the
Is it 150?
105 Sigma
Oh,
105.
the 105. Yeah,
Yeah, so if
yeah.
there's any dental students or young dentists watching, this is the initial first thing you want to be buying because it's just the best thing to take any kind of close up with. I
And it's good value. Like compared to the Canon, it's a lot cheaper
have you looked at an
as
L
well.
series lens? I mean, that's kind of like the gold.
Oh, £1,000, isn't it?
Yeah, I
Plus.
mean, I don't have a Canon, so I don't know why I'm looking at L series lenses, but yeah, they're so expensive. I have heard people using 60 mils though. I don't know if you've tried with a 60 mil because I suppose you could get a bit closer to the patient when you're taking the shot.
Yeah, well, I actually I've ended up using two different cameras because I find it a lot easier instead of switching the lenses and stuff. So I'm pretty much using um that Sigma lens on an older
Yeah,
Canon body to take my close-ups, and then I've got a newer. I originally bought the camera for my sister's birthday, and then I decided I was going to keep it.
perfect.
So she had it for a few months, and then I just took it back. So I've got a 6D, and I'm using just like a small lens to take portraits
Mm.
and things. But I've started messing around with softboxes, and I just find that the light when you get a softbox, you get some amazing photos with it.
Have you got
So
bouncers yet? The bouncers, and then bouncing the light off the
the
what they call them.
no,
You
I
you need to
haven't.
look into it. So basically, you get the flash, your main flash, and then you get like speed lights, and then you get the
Yeah.
speed light to bounce the flash off, and then give a glow backwards. So in the opposite direction
Oh,
to where you're
nice.
taking. It's insane. But if you look at someone like Minesh Patel, that's a lot of the stuff that he's
Yeah.
doing to get those like really like you could see the texture of the lips and stuff. And
Yeah. Well, at the minute, I've got two different softboxes, and I'm always moving them around and to try and get that texture. But I've basically during lockdown we've been a little bit busy, so we've been getting a new surgery booked
all right.
together. So it's my new. So I'm getting that all installed now properly in the walls, and I'm just loving it. Once you get to a point, you just start loving taking your
It's the
photos.
only reason I like dentistry, to be honest. I'm not even
Yeah.
joking.
I love the digital stuff. I just love playing with all the new toys. That's me. I'm not even bothered about it being viable for the business. Now I'm just like, how much fun can I have planning
I
this?
think is people think, oh yeah, he's just saying that for a laugh, but I'm not even joking. Like, I mean, half of my reason for going
Yeah.
into work is that I can mess around with the microscope and like take videos of things that I'm doing. Like, there was this one incredible scale I remember. I remember seeing the patient before the scope
Yeah.
arrived and said, okay, well, why don't you go do a couple of weeks of OHI? You know, I gave them all the information, and I'll plan to give you an immediate denture, and we'll do an extraction
Yeah.
on that day. But in my head, at the same time, I was thinking there's big chunks of calculus which engulf these teeth. If you guys haven't seen this, go.
Yeah.
It's on my. I think it's on IGTV on my profile, and I did extractions via scalar, ultrasonic,
Oh,
because
nice.
I knew they were moving because you'd taken the X-rays.
They're that
I'd taken the
loose.
X-rays, so I knew they were going to come. I was like, this is going to be nice and kind of. It'll look a bit exotic or whatever, because if I could take a video like that and a bit of shock value, and she was happy for me to do it and everything, so it's all great. So
So how does it work? So you have your camera body attached to the scope. Is that
yeah,
it? And then you can just record directly on that. That's
yeah.
pretty
So
awesome.
I have my had because I'm no longer in that job because I decided I didn't want to go back to the
Yeah.
NHS and stuff like
Yeah.
that, but and a few other reasons. But I have an iPad mount on my tray table. So my iPad's there with
Hmm.
a live view. So Sony's they've got a mirrorless app where you can
Yeah.
have a live view. So I've got that there so I can check the focusing. And then my
Mm.
nurse has got a remote control, so she hits the remote. We either take a still photo or we start recording. And it's
Nice,
great for
nice.
other stuff like endo because she can see what's going on whilst I've got really close up and stuff, so
Yeah.
you can see what's going on. But yeah, then you can like show the patient stuff. You can do all these kinds of really cool things, and I think I'm more interested in the technical side than the rest of the
Yeah.
dentistry.
Yeah, it's just that nitty-gritty. You get to a point and you just love it. You're just like, "Oh, I wanna." When you're trying to improve constantly, the only way to do it is to, like, record your procedures, look
Yeah,
back at them, look at it in closer detail. Because if you don't reflect on it, how are you gonna improve? If you just
yeah.
keep doing the same.
Yeah, I always a wonder when people say that they don't take many photos and they want to go into like private practice, how they're going to, improve to that level that is going to make a difference. So I'm just going to move my microphone so I can see your screen. At the moment, I'm just getting cross-eyed because I've got the microphone in the middle. There we go.
See, the problem that I have is now that I'm taking a lot more higher quality photos, when I look at my photos, I'm always picking up things and I'm just like, oh, now that I've seen it. like the patient loves it and they're happy, but you're just looking at it going, I could have just got that little bit. Oh.
Yeah, that's kind of the plus and the negative, because obviously you're going to improve so much faster because you see it. Whereas
that's
the
true.
other side, when I first, for example, took photographs, just with a straight DSLR and not taking, I mean, I didn't have the scope to start with because, took a bit of a hit on that.
Yeah.
So when I first started doing that, I was looking at these going, you can't see that with your eyes, because I didn't have loops at that point. So I went from no loops to full whack because I thought, well, there's no point going to that intermediate step. I know I want to do an endo sort of related thing anyway in the end. Even if it's just special interest, you need to have the scope. So I'm not going to buy loops. And then you bring the scope and you go, oh my God, I've never seen this before. This is a tooth? What's this? What's this? And then, so you're now at a point where you're going, what was I doing before? And that's pretty terrifying.
Do you know what? And do you know what always gets me is that patients have no idea of the internal dilemmas that dentists go through when they look at stuff, and they're just like, I feel like as a profession, it's good because we're very hard on ourselves. Like the level of accuracy that most of my colleagues will hold themselves to is just super high, which is great. But patients never realize the internal.
No, it's I mean, funny enough, I went for a short walk before we started, and I was literally talking to my friend, and we were talking about struggles that certain people had and stuff like that. And he goes, you know what? The patients haven't got a clue at this point now. I was struggling before, but now it's more like if I'm happy, they're not going to have an issue, and that's like more important. So yeah, it's exactly that. Yeah. What kind of work are you doing at the moment, actually? Because I think we spoke a lot about RCF in the first couple of videos, because we've done like the first hour video where we just talked about RCF. What kind of work are you doing? How do you fit in with the RCF side?
Well, yeah. So, I mean, I work full time, 9 to 5. I used to do Saturdays, and then it just got a bit much. So, I've dropped my Saturdays, and then normally we have a trustee meeting once a month, and then we'll kind of meet up. We'll plan what we're going to be doing with the charity that month, the way forward. If there's any big crises, how we're going to deal with that. Obviously, if something comes up, we do hold emergency meetings as well. And then in between, we all have different delegations, different groups. So we've got the dental trustees, we've got social media, we've got kind of accounts, and then we have some of the more general. And then obviously Kieran is in charge of most of the stuff. So we kind of plan and we delegate duties. So we have a lot of documents where we track everything, we record meetings, and that's how we remember what we need to do, and we'll kind of plot that through the month. So, for example, at the minute there's been a big fire at a refugee camp in Greece. So we are looking at different strategies in how we can try and help them. We're looking at our current funds and if it's better just to work with a local charity, which I think we're probably leaning towards, to try and get the relief there as immediately as possible. So kind of things like that. And so usually that will be in the afternoons, or I'll kind of book 1 or 2 weekends to work away on things. There's a lot of paperwork, like a lot of paperwork that goes in the background. We normally do grant applications, so that kind of takes up quite a significant amount of time. So those are kind of like the background runnings, and then obviously you'll see the main things, which will be us doing events, going out to the campsite, doing stuff like this, chatting to you guys, social media, podcasts. So there's kind of two sides to the charity, and it does take up time if you want to be dedicated to it, but it's not all encompassing. You still get some of your own time as well, so it's not the end of the world. Although to be honest with work, I've kind of got to the point where I'm a bit fed up working 5 days, so I'm now dropping down to 4 days. But that's more for myself and just to enjoy my work a little bit more and not be constantly on it all the time.
Yeah, I can imagine because I think my ideal would be 3 days, maybe maybe
Yeah,
3 days. Um,
I'm not going to Uber to let me do three yet. I probably shouldn't say that. He might be watching.
yeah. The guys who are watching, please
Fine.
do hit the like button and share to any of your friends. Big thank you for anyone who's joined us. And ask any questions if you've got any questions for Ali about RCF, any questions about working in the UK as a dentist as well. Um, I heard, Little Bird told me that you do the VTE trainer stuff.
Yes, I do. So yeah, the VTE is an interesting one because you get kind of all sorts of dentists who need to do it. Some dentists you get who are very
Yeah,
experienced, and it's just one of those odd rules where to work in the NHS you need to get like a year of being signed off, and they don't really offer it for people outside of the UK, outside of UK
mm,
graduates. So that's one way of doing the scheme, and then also we sometimes see VTEs of people who are newly graduated and they just need some support. So I really enjoy it. I think the teaching side is one, it gives you a different take on dentistry because when you think about some of the procedures that you do it because you know how to do it. But then when you have to stop and go, well, what is it that I'm doing, and try and break it down and tell someone
yeah,
what you're doing, it kind of makes you consider each aspect of your procedures or your treatments a lot more. Um, so it's a learning experience for me as well. But I really do enjoy it. It's a different challenge, and it's good as well. I think it's important to give back to the wider dental community, not just to focus on yourself. So helping other dentists out is always enjoyable, and it I think it helps with things like dental burnout, where people are just doing the same thing day in day out. They're not really changing things up, having a break, enjoying what they're doing. So for me, that's one of the main things. I really just love the VT side, the teaching. Um, it takes a little bit of work to get into.
yeah.
There's, as with anything, just there's some paperwork. um, the route I took was I did a certificate in facilitating healthcare learning. Um, I had to get registered as a CQC manager, and then they would come and they do an inspection. They go through your paperwork, they see how you work, they do audits on your radiography, your note keeping, all this kind of stuff, which is very useful because it's good for me to know
What your
that
level
my note
is?
keeping,
Yeah,
my audit thing, yeah, what my level's at before I get in trouble and somebody's doing it. um, so it's good to get a good nod saying that yeah, that's all fine. Um, so it's an interesting experience. But I've started getting a lot of DMs from people from being like, "So I hear you do VTE training."
yeah. I think people are really
uh,
struggling this year, especially, aren't they?
yeah, it's very difficult. The problem is me personally, I only like to take on one at a
Mm,
time. I think it takes up a significant amount of my personal attention because we have to run tutorials depending on their experience level. I like to do observations. I like to leave time for them to chat to me and like discuss things. So it's finding a balancing act. Surgery time wise, to be honest, it's not always really that worth it for the practice because they tend to be a bit slower to start with initially, and but the way you got to look at it, it's a long term. You're trying to build someone up to be a good dentist in the
yeah,
long term, which can really benefit yourself and your practice long term. So I definitely advise it. And you got to just focus on teaching them the right things and letting them build themselves up at the right
yeah,
pace. I see a lot of young dentists are wanting to hit 1,000,000 miles an hour straight away, and they're not taking the time to build up the basic skills. You got to like, for me, you got to do hundreds of hours of crown preps before you even have a clue. That's how I felt anyway, in my opinion.
yeah,
Like
yeah,
and then the more I did it, the more I realized the less I knew, and the more then you improve. But it's just that constant cycle.
yeah. I think it's one of those things because I think the guys in the UK, we're getting less and less experience in uni, which I know is, I think, well, I've been to one of the GDC events where we were literally talking about preparedness to practice last November, and it was kind of across the board. People felt that the quality of the graduates, through no fault of their own, mainly due to the lack of clinical teaching or clinical experience, was like dropping year on year. And then you get into this situation where out in the real world, patients have got higher and higher expectations. The real wage has gone
Yeah,
down.
education rates.
Mm,
It's a difficult time for everyone, but I see a lot of these posts and there's a lot of doom and gloom. But for me, I've found the first few years are tough because you're kind of finding your way, you're finding your experience. But if you put yourself in a positive environment and you're constantly trying to improve, you will start to enjoy your dentistry more and
yeah, no,
more.
that's for sure.
If you're looking forward to doing that amazing prep and you just see it come out and you go, finally, I've achieved that thing that I've seen on all these amazing groups like Sal Italiano and like the Sarah groups, and you start to get to that level, that's when you enjoy your work. But when you just kind of go to work and you just do, oh, I'm going to do an average, I'll just smash it out. I'm going to do 10 of these today just to get my money up. You don't enjoy your work, and the salary will come with the experience and the
Yeah,
quality.
I think part of it is, the guys that have taken out loans from university, so they're thinking, well, crap,
Yeah.
I've got to get on top of the loan. I need to buy a house, weddings, and all these other things that come in the way. And you go, well, can I afford to take a year or 2 years, 3 years sometimes, and just try and improve? I think
Yeah.
that's the really scary part for a lot of people, which is fair enough.
No, it is
Mm,
true. See, this is where I'm very grateful that I went to university in Ireland because we don't really have a student loan situation because the courses are very heavily subsidized. So you pay like a nominal fee, but you don't really have to pay
mm.
tuition fees. So it's I think it's great. Unfortunately, no, UK dentists aren't quite as
No,
lucky.
not
So I
anymore. I was one of the last years where we were lucky enough not to have a horrible amount to pay for per year.
yeah. But it does change the dynamic for sure. But it's balancing that pressure and your personal ethics and your skill level, and I think that's something that every young dentist struggles with. And to be honest, I do find that the majority of them they do find a very good balance. Um, and it's I also do I've seen some people that I've trained who've been very hesitant and they're underestimating their skill levels and they're holding themselves back. And I've seen people who probably overestimate their skill levels a little bit. So this is why reflection and talking to your peers is very
Yeah,
important.
yeah,
So, and having a good support network. Don't be afraid to ask someone for an opinion. Take a quick photo, send it to a mentor, to a colleague, to a friend. It's very easy just to just see how somebody else would deal with it. There's some great forums. Even the Dentist UK. Now, I've seen some cases where people have been like, "How do you not know how to do this?" And I really feel dentists shouldn't do that. It should be very positive feedback and giving people good advice. Um, and that I think that's one of my main concerns for really young dentists coming out is there's a lot of negativity going around. And personally, I don't know why because I love my job and I think my job's been great. I've had some jobs which I haven't loved, and you just got to get out of it and find another one. Don't be afraid to move. Um, like I grew up in Ireland. I went to
yeah,
university there. I had to move country to find the right job, and sometimes that's what you got to do. But it doesn't mean that everyone else has to. Um, but where I was, I went in and it was just a really old NHS practice, and we decided just to take it over and just build it from the ground up. And don't be afraid to do that. If you put in the time and effort to build the quality, build your reputation, the patients will come. So in 5 years we've gone from and myself, I was a very basic dentist. I did my VTE, then I worked a pilot contract for 2 years. Did no additional training. I just wanted to relax after uni. And to be honest, I found dental school really tough and
yeah.
stressful.
It can be. It
And
can be
then
really
that,
kind of tiring
yeah,
and kind of take it all out of you.
and I
Yeah,
just wanted an easy job. I just wanted an easy job for 2 years, just relax, not be too worried about UDA targets, things like that. And then afterwards, I found a good mentor who pushed me, went on an implant course, started doing Invisalign, and now then eventually I started doing my VTE. So I didn't run into it. I took my time, and now I really enjoy the place that I'm at. But everyone has a different path, so don't be afraid to start being a VTE trainer a bit older, or if you're doing really well, you've got experience, you might want to look into it a little bit younger. It just varies from person to person.
Yeah, yeah, I
But
think that's true. Hold on, let me just check the sound. It sounded a bit funny for a second.
mhm.
No, I think we're generally good. If you could turn your microphone down one notch, if that's a possibility.
uh, maybe just use my phone right here.
Guys, is it sounding okay?
I don't know if you're able to.
I think we're okay now. I think we're okay. I just saw it hitting. I saw it hitting
Okay.
red, and I was worried that we were getting a bit of clipping at the top of at the top of your voice. Yeah, no, I think everything you said there is really, really key. You know, there's a lot of dentists, young dentists out there with um, hoping to get into kind of aesthetic work and all these other kinds of things, and it's definitely possible. You just got to. I always say, if you're going to do something, make sure that that's definitely first of all what you want to do, and then
Mhm.
almost only do that because you know you need to build up the experience in that particular field as much as you can. So if you're doing composite veneers, learn your bonding perfectly first. Absolutely get to the top of your,
Yeah,
you know,
like
like
master it. Yeah,
really, really
for
know it.
sure.
Don't do a bit of this and a bit of that and a bit of this and a bit of that, because at some point everything is going to be a 6 out of 10 as opposed to being 10 out of 10
Mhm.
everywhere. And there are going to be guys who are incredible. You know, 1 out of 1,000 is going to be able to do everything all the time, but that's not
Yeah.
everyone. And you generally know if that's you, and you either someone who's going to shout about it, um, or you're going to keep quiet. So um, probably just I think people need
Yeah.
to know
Yeah,
themselves.
I think finding your niche, finding what you enjoy is so important in dentistry. Even if it is that dark art of endo. I don't know why people do it, but everyone has to. Somebody has to.
It's not that bad. Again, it's the same. It's part of the whole technology thing, because it's something which is a real challenge. Like, it's really difficult.
Yeah.
Um,
How are you finding? Are you doing much CBCT in endo?
I'm not working at the moment, so I'm finding nothing at the moment.
Oh yeah.
I did interview for a job.
Some interesting uses
I
of it.
did do an interview for a job where he was looking at putting the CBCT in, which I was buzzing about. And it's interesting because you can do all sorts of things, like guided endo is now a thing where
Mm,
obviously it's not for the average guy to do, and probably I will work up to it. It's probably not something I'll dive in at straight away,
yeah.
but you can get to a point where you go, okay, we're going to take a cone beam, and it does change your management, because you're going to see there's the MB2 exactly there.
Yeah.
Most of the time, you're not going to find it without um, without just searching blindly almost. And now you can see where something is. You can see if there's a lateral kind of canal where you can
Yeah.
see all these sorts of extra little bits of um,
Y- like the true apex versus
yeah,
the X-ray
yeah.
radiographic.
But also you
So
can do these things called, you can get a 3D printed model. So you put your rubber down on printed model, and it's guided one, two, three,
yeah,
4 holes, or 2 holes, 3 holes, whatever the tooth is,
yeah.
and it's taking you right into the area you need to be. So
Just like the implants.
you're
That's
saving a lot
awesome.
of dentine, so you're less likely to have catastrophic failures further on. But also, you could sometimes have teeth where you can't see a curve on a normal PA, just doesn't show
Hmm.
up. And there's a really good example if you go on YouTube. I can't remember the exact video. He takes a PA and it just looks, oh yeah, cool, nice endo. Then he takes a cone beam, because I
Mm,
think he's American, so they take cone beam a lot more frequently than we do, which
yeah.
I kind of agree with now. And it's a
Yeah.
95 degree angle right
Wow.
back up, and you're going, right, that's got to go to specialist, because that is not something you can do. Um, and it's one of those things that otherwise you'd have gone in there and you'd alleged and you perforated, or you'd have done something,
Yeah, it's perforated straight through. Probably wouldn't have known. Yeah.
and then you going, oh, sorry, and you got that whole issue.
That's it. It's the old
Mm.
parallax, isn't it? There's always a great meme that I see posted about is it Prince William, and he's holding a hand up like this, but they've got a picture from the side, and it looks like he's just holding his middle finger up. Just go perspective. It's very important.
Yeah. And we're getting all the wide angle lenses where people are taking pictures of different gatherings, and then it's looking like it's all really
Yeah.
really close, and it's not really in reality. And you can
Uh-huh.
do it the opposite way around as well. Um,
Yeah,
yeah,
sure.
no, it's crazy. But yeah, that's my love of endo.
No, do you know what? I'm loving how digital dentistry is getting these days. It's so exciting, and like I just love the digital side. I've got like a 3D printer at work, and even though I have a lab who does all this stuff, I just at lunchtimes I'm like planning composite bonding and veneers and just shaping things up. And I think having that extra bit of control helps you one to get that next level of detail, and you start to understand more of the process. I
Yeah.
think that's something not really understood like that. What the lab do, you just kind of sand them the crown, you give them the parameters, and it just comes back somehow. So once you start looking at the staining, the glazing, the texture, you can really turn
Are
things up
you
a
still
notch.
sending your posterior units to a lab, or are you doing them in house now?
No, no, that's still going to the lab. I don't have a milling unit yet. um, Definitely in the
Yeah,
pipeline.
because I've been seeing some. Well, it depends on how long the actual milling process takes place, but I've been seeing people who are prepping under dam. You know, they're
Yep,
replacing an old amalgam or something, and obviously we know that
yeah,
well, a lot of the old amalgams have cracks around them, so you're taking down a couple of the walls and you're planning for an onlay of some sort. And
yeah.
he's doing a very minimal reduction of all these walls and things, and then he scans with the dam on, so you've got
Yeah, I've seen
perfect
that.
anatomy.
And then they're getting it milled. They mill it in about an hour, and then it takes maybe 20 minutes, 30 minutes to fire it and process it. But you're just thinking that's a long time to leave the dam on. Just take it off and let the patient have
I
a
don't know if
rest,
they
put it
take
back on.
I don't know if they don't take the dam off. Maybe they take it off and send the patient to come back in an hour or so or something. Because an hour's not going to
Yeah.
make a difference.
I no, I've seen one guy who leaves it
I mean,
on.
I probably would. I'd say, look, well,
That's just
I'm not getting a
cruel.
second damn kit out.
I know an endodontist would. They'll go, oh, let's get that seal. It's nice and tidy. There's no saliva getting
Yeah,
in.
well. I mean, if you think about it, well, you tell the patient, all right, you're going to have one appointment and you're finished,
Yeah.
but I'm going to sit you there for an hour and a half in the waiting room with the dam on because I don't want to use a second rubber dam kit. I'm probably taking that. I'm probably going to be one of those guys.
I think it's more to do with saliva contamination, right? Keeping it as
Well, that
clean
as
as
well.
possible. But I think if you're going to do that, you need to have like a Netflix room, right? Where you can't just stick them in the waiting room. Yeah.
Yeah, but it makes sense because you scan it, you get a perfect margin. You don't have any saliva come through. You don't have
Yeah.
retraction is not an issue because you can use brinkers.
You're not having to worry about temporization or anything like that.
Save on that.
Yeah.
You could
Straight
probably charge the patient a bit more because it's one day as well. So you've saved on some
through
particular
in house.
materials and upped your margins, which is pretty clever. Um,
But, and it's just, you know, it is fun though. It is just fun doing it like that. That's because not many people can provide that service
no,
either.
I think it's probably better because if you're someone who's at that level of
Mm.
like thinking about it in that way, then you're probably doing a more biomimetic approach, which is the buzzword everyone likes to hear about now these days.
I do enjoy it though, because you do your scan and you just go copy. Like you can literally get pretty much the same
Yeah.
anatomy.
Which scanner do you use?
I've got a Trios 3. I really wish I'd gone for the wireless version because that I'm constantly nearly pulling the scanner off and having a very expensive accident with the wires. But I love it, and it's just had an update actually,
All
the
right.
Trios scanners, and I love the accuracy of it. It's so nice. Since I've started using, I use it for everything now. I use it for my Invisalign, even just straightforward preps, even my NHS preps. I just use it now. I see no reason not to. And I find that generally my fit and my occlusion is so much better now. Requires a lot less adjustments, crowns being sent back. So although it might take a little bit longer doing the scan and getting the data, the time you save in adjustments and just reappointments and things,
Oh,
if
you
you're not
just
happy
look
with the
so
crown,
stupid
is
if you have to keep on sending the crown back as well, don't you?
oh. And patients are like, why did you not get it right? And you're like, no, listen, there's a 4% discrepancy with the models. It's not my fault. They're like,
And also that
yeah,
they like to
sure.
move. They like to move while you're taking it. Like, oh, okay,
Oh
you're
yeah,
there like this, holding it in, and they go,
yeah,
"Oh, sorry, I'm just gonna shut up now," and you're still there
yeah, yeah.
going with them. Sorry if I got a bit loud there on the stream, guys. I went a bit close to that microphone, but yeah, and then
Yeah,
obviously it's gonna
always get that bite together. bite together, just yeah, yeah, okay. And you go, that cannot be how you bite together. And they're like, yeah.
Yeah, that's the thing. And then with a scan, perfect because it's a
Yeah,
scan and you can see how things have changed over time. I don't know if the Trios allows you to do that.
it does. Yeah, yeah. It's got a tooth wear tracking facility, which is great. And also, it's just the fact that you don't like we don't have room to store thousands of models for every patient, but every single patient now, when they get a full scan, they always have that, which means if there's an emergency, they have a fracture, I can print off a model, do a pull down stent within an hour,
Yeah,
hour and a half. I can get the tooth restored the exact same shape, same day. Um, and then if there's any wear, if there's any changes, any cracks that form, you can just quickly flick onto their chart and have a look. So I think the patient education aspect is
yeah.
very nice. Patients love it as well,
Oh, of
by the way. When
course.
you stick the scan up and you're like, I've got a touch screen as well, so I'm literally like zooming and doing all of that. And then you can just you can explain to them when they look at the amalgam, they can see the cracks, and you say, look, this is why I need to do this treatment. So I feel like the scanner is paid for itself
Well, it's
very
just exactly
quickly.
the same with the Sony and the scope.
Yeah,
I can be taking
yeah,
14 photos inside the mouth as I'm going through because I'll just be like, "Yeah,
yeah,
photo please, light and focused. Yep, good.
yeah.
Photo please." And then at the end,
You're not having to stop the procedure, right, and to like do the photo or
well,
anything.
I have to tell
Awesome.
yeah the nurse that I was working with to
Yeah, just
to
to
hit the
just
button.
yeah, but you're not
Oh,
like
I'm not.
taking the microscope off, getting the
Yeah.
zoom lens in, like getting like
I
yeah.
mean, they're not a work of art. These photographs. They're literally similar to an intraoral wand one, but I don't have to move, which is
Hmm.
the difference. You know, with the wand, you've got to bring it over. I can literally just be going along and just say, "Yep, photo please," as we're going along. So I don't have to faff around going in and out. And again, yeah, the iPad is just there, so I'll set them up, go. This one's got a crack. This one's got this, that, and there's literally like a couple of thousand photographs on my iPad of the tooth.
Yeah,
Obviously, you know, then you can just show them. Go, okay, this is the one that I'm a bit more worried about. I can see that it's quite a thick line here, and it's very big amalgam. On the depth on the X-ray looks like this, and you just build up a picture of what's going on. And scanner is the another step in that direction.
yeah. So it's an exciting time for young dentists. I really think it is.
Yeah.
Um, And I know that like dentistry's kind of gone through a bit of a period, and there's problems with the NHS and the contract. But if you look for the positives, you look for the stuff that we can do. Like we can now start doing things that dentists couldn't even dream of doing 30 years ago, like with workflows and timing and precision and just even planning, digital planning, smile designs. There's so much just fun stuff to get into. So don't get bogged down in just the boring stuff. Work on your basics and do the fun stuff. That's where
So
it's
do you
at.
reckon? Because I'm maybe controversial in this way, and I don't know if you've heard this before, but my thoughts are
Mm,
that if you give a crap about your work as a young dentist, just do your normal, simple
yeah,
dentistry, but do it
yeah, yeah,
outside the NHS framework. Take away your target based driven mentality because you'll get sucked in. You will get sucked in, and your principal will ask you to do another 1,000 UDAs in February because the practice is
yeah.
behind.
Been there. I've been
And
there. Never again. I tell
it,
myself.
it it happens, and then they say,
Yeah.
"Oh, you can work at that pace, can you?
Yeah. Oh, keep it up.
Well, do
Yeah.
you mind doing another 2,500 next year? Just do 8.5. That'd be like 90 grand."
Yeah, I know, but this is the thing. You need to set
Well, yeah,
realistic targets. And for me, once you start getting past 6 to 7 thousand UDAs, you're really stretching it there. In my opinion, I know there's people who can do it. They've worked at a place for a long time. They have a very stable patient list, and they've worked hard to get their patients there. But if you're
mm,
going into somewhere that's not in that situation, um, you need to be realistic on what you think you can achieve to a decent standard. And I think for young graduates, I would recommend maybe 4.5 to 5,000. I think is kind of even
yeah.
that you're going to be pushing it, but you'd be able to do a reasonable job there, and just focus on doing it right
I took
first.
five
And
and a
then once
half.
you do,
Yeah.
yeah, and then once you do it right for long enough, then you'll get quick at doing it right. And then once you get quick at doing it right, you can then start taking your time and doing it better. doing it more detail, and the speed will come. The speed always comes with anything. I still think back at the first time I tried to put rubber dam on. It was like a wrestling match with the patient
Ooh.
and the tongue, and oh my days, there was like holes in I don't know. I feel like there's holes in the patient in my rubber sheet, saliva everywhere, and then now I just go clip, wing clamp, on, floss, done. Like
Yeah,
it's
my
just
my
those.
thoughts during, and this changed during lockdown because I was, quite excited to go back and stuff, and then my mindset changed a little. Because first of all, we weren't happy to go back at the time because grandma and stuff like that. But then afterwards as well, we're thinking,
Yeah.
well, I was knackered when I came home because I'd done the UDAs and
Mhm.
stuff. So I thought, well, if I go back, I want to go into a private job. So my recommendation now, and this is probably controversial, is do your FD, then find a
Yeah.
private job just doing general dentistry, simple, normal, usual stuff, and slowly upskill from there.
Yeah.
That's a big risk, though, isn't it? Because getting the patients in, you might be sat around twiddling your thumbs a little bit. You might not have the
Yeah. You got to build that list, don't you? Because it's not easy just to walk into a job like that and they're going to give you a full list.
no.
Because you're not proven yet, right? You don't have that experience, you don't have the cases. But this, I think my top tip is even in your FD, get the camera out, get that camera
Damn everything.
early. Um, yeah, damn everything. Get in a habit of damming. Because then it becomes quick. It just becomes
Yeah.
part of the procedure. And get the camera out and really look at your work. Take some time with it. And then this has become like a tutorial for young dentists. I'm loving
Well,
it.
this is what I wanted to keep it really open. I was like, well, we've got to talk about RCF, to start because it's
Yeah,
quite important to both of our lives in the last 6 weeks for me certainly, and then most of your life since you started since. And I
yeah,
thought, what, I'm not going to give you any topic. We're just going to see where it goes. But I think this is important because um, I get so many questions around these topics. I get so many questions about people wanting to come to
yeah.
the UK. There's so many questions about all these sorts of things. So. Um,
Do you know what I see a lot is a lot of people have been posting, "Oh, my kid's asking me if I should do dentistry," and I'm telling them absolutely not. And I'm going, "Why? The job's amazing. You've got good job security. If you're good at what you do, you'll have a
I
good
tell them
life.
yes, but don't do it in the
You'll
UK.
Yeah, yeah. Go to Canada, yeah, America. And you got flexible working hours in most cases. Like you're not doing on calls at the hospital. You're not working crazy shifts unless you do max fax. And again, you're one of those crazy people who wants to do it fair
Yeah.
play. um, so you've got a lot of options of what to do. If you want to just help people, you want to work in the NHS, you've got that option. If you want to do really nice smile makeovers, build people confidence, you have that option.
Mm.
You can go abroad, you can do volunteering like I do. There's a lot of flexibility with the
Yeah,
career.
I mean, you can
So,
you actually can't do podcasting now because I've got that covered. Sorry, guys,
oh yeah, you got
but
that
no,
covered.
no. Yeah, there are so many things that you can do. There's media work. There's you can even go to litigation if you really want to because there are bad dentists out there, unfortunately. But so if you end up doing it and maybe don't like it, that's always a route you can go down.
That's an option. You won't have any more friends who are
I know,
dentists,
but
but it's an
you know.
option.
Unless you're just ticking off people's rivals.
Yeah, that's true.
um,
Make a
Yeah,
hit
but this, I
list.
mean, for myself, for example, like I went in, and I'll be honest, I didn't have a clue about dentistry when I went in. I just kind of like, oh yeah, it seems like a 9 to 5. Seems pretty surgical. I've seen
Yeah,
a lot of blood there. That sounds that
yeah,
sounds fun. And that was the extent of
yeah,
honestly, that was the extent of my knowledge. I didn't know what caries was. I didn't know what gum disease was
yeah.
because I'd barely ever been to the dentist because uh, whenever I
Mm,
went, there's nothing wrong. And my uncle's a dentist, so every now and then we'd see him, and so he'd look, yeah, you're fine, maybe a bit of a clean. That's it. So I mean, the only times I actually went was to get mouth guards made for rugby, and I remember maybe one other
mhm,
time my friend had an appointment, and I was going to his house that day, so his mom took me in with him, and they checked my teeth there. So
yeah.
I had like maybe 3 or 4 appointments as a child, so I had no idea, not a clue.
You know what that is? That's a solid one UDA right there. That's a two
Oh
minute
yeah, I'll do that.
checkup. Yeah, be 17. Yeah, yeah, no worries. Oh, he's here, is it? Yeah.
What was that? A band 2 scale?
Yeah, yeah. Bit of fissure sealant, clean that
Yeah.
cavity.
No,
Uh,
but that's
yeah,
I had no
yeah,
idea.
yeah.
I almost got lucky in a way that I actually like some of what we do. I mean, there's things that I dislike, which is fair enough. People are going to find the same things. And there's things that I'm just like I could take it or leave it. So the same way, but technology,
Yeah.
love it. Endo.
Yeah, and you know what the thing is you can set yourself up in a way that you only have to do the bits you
Yeah.
like. If you don't like doing perio, you refer it to somebody who does. You don't like doing endo, you refer it to somebody who does. Like there's always somebody who will enjoy
Yeah.
that field. Like you don't want to do surgery, that's fine. Just refer someone who's good at that, right? Like you don't have to be stuck in the general dentistry route. You don't have to be a specialist either to not have to do that
No,
stuff.
and that's the thing.
There's lots of courses. There's lots of courses out there. You can do a course on whatever you want, as long as you apply that knowledge. You don't just do the course
Do the
just
same thing
for
you
the
already did.
the
Yeah.
day out. Yeah, like if you're going to go on a course, you need to research why you want to go on that course, what benefits going to have, and then you need to use the information from that course. Or it's just going to be a waste of your time and money, and you won't progress. So I think that's
You
really
don't even need to
important.
go on courses these days, apart from your actual
You don't.
CPD. You really
Yeah,
don't.
yeah. It, I mean, if you've got a good support network, you've got good mentors, you've got people who post all the time on the groups, and if you DM them, I'm sure they would be more than happy to talk
YouTube,
you
you
through their
can watch an
procedures.
entire
Yeah.
procedure start to finish
Mhm.
from a specialist
Yeah.
and go, okay, yeah, I've not done that before. And you think actually, for example, that's something that I can easily do. You know, troughing with a burr, I can do that. I just need the burr. Easy, done.
Yeah, and the thing is a lot of the skills you'll have like you'll have surgical skills from
Mm.
doing extractions. Everyone knows how to suture, right? Like myself, I was scared of the surgical aspect of dentistry for about 3 years. Like the thought of taking a tooth out used to give me stress, and now I absolutely love it because you just have to overcome that barrier at some point as well. And sometimes it's okay to be outside of your comfort zone. Now, don't go crazy. Like, don't be taking out impacted wisdom teeth if you're not good at taking out premolars, or
Yeah,
incisors.
certainly surgically.
But you gotta put, yeah, it's definitely surgically. Keep clear the ID nerve. But if you get a good mentor as well, or like you said, just YouTube videos, you can learn a lot from them. You can see why people are doing certain things, and there's some good journals out there as well. I quite like Dental
Mm.
Update. I think it gives good, up to date kind of research with clinical aspects as well, and that's it's very interesting, and you can see what's kind of going on in the dental world. So don't get in the habit of not reading around your work if you can. Now, it's not always
Yeah,
possible.
I think you've got to find something you're really interested in to then have the
Yeah,
desire to want to go ahead and
yeah,
really read up
right.
on stuff. So yeah, I mean, one of my friends, one of the guys in the Patreon group, has sent me a 45 endo lectures or endo things to go through. I'm slowly going
No,
through them, slowly going through them, Ricardo, if you are watching. But yeah, it's one of those things. But I couldn't imagine having to do that with perio. Just be like, no chance,
oh
mate,
no,
not a chance.
we've got people for
Yeah,
that.
but the thing is, perio surgery is really interesting, but normal perio is just very, very dull.
Yeah, well, that's true. That's true. I love chatting to. I know two periodontists, Coram and Fazan, who are based out of Manchester. So I'm always bugging those guys to be like, "Oh, you got a course coming up? Can I
Does one
can
of
I
those
come?"
guys have something to do with that little cafe?
Yes, Seed and
I
Cherry. Yeah,
thought I
yeah,
recognized his name. Yeah, yeah.
yeah, yeah. He's a periodontist who owns
Get
that.
him in
Yeah.
contact. I would love to speak to him on this podcast. Actually, um,
Oh yeah, yeah. I'll pass his details over. He'd 100% do it. He's a fun guy. But he's one of those where he's done a lot of dentistry, and he's kind of got to a point where he goes, you know what, I'm taking a step back from dentistry, and now he wants to do business, which is
that's gonna be
fine.
interesting.
He's
That's gonna be
decided.
super interesting.
Yeah, and he's done an MBA, and he's gone a different route that most specialists don't go. So you never know what route life will take you. So he would definitely be a fun
I'm
person to chat to.
pretty certain I've been to Nando's with him the very same day my car
Yeah,
got broken into in Manchester. I'm pretty sure. I'm
yeah.
pretty sure it's that exact day. Um, yeah,
But you find dentistry is a small world as well. Everybody knows everybody
yeah.
else.
It's one of those. It is fun though because you get to meet people quite a lot, and if you go to different events, like when we went to the RCF Manchester, in the Vermilion. The
Yeah,
day
yeah,
I
the
wore
garlic.
everything
Right?
completely wrong. Um, then there's guys there who knew me from Instagram, which was the first time I ever got noticed, like in real life, which was really really weird.
Nice. That
I
boost
did not
lifestyle
like it at
coming
all.
through.
I was very taken aback because I remember Oasis. He came up to me, a familiar face Oasis. He came up to me and he was like, "Oh, you're the guy from dentistry." He's like, "Yeah." Just I was like, "Oh crap, someone knows me." Uh, I better watch what
Recognized.
I say. But it was one of those, it's a very small world out there, and it's great because you can go to a conference anywhere and have someone to go and chill with or someone that you know. And that's the same thing, I went to Chicago to the Midwinter and there was tons of guys. That's why a lot of these guys that I brought on, I kind of got the first kind of chat with them there. And then they introduced me to other people who then introduced me to other people. And then you have like a weird network going.
You know what? I think you've touched on a point there that one of the most fun bits of dentistry is going to these conferences abroad, and you get to have some fun. You get to go away, and you also get to learn about your job, like what's not to
Yeah.
love, right? So I think that's the one thing that COVID is really killing for me, because I've been dying to go on a conference to
Oh,
Japan
Japan.
to look at some of these, like there's some really awesome denture techniques that they're doing over there, and I just can't wait to go over. But it's just not feasible right now with
Mm.
COVID. But that's one on the bucket list. It's a bit of a weird bucket list thing. Do a denture course in Japan.
Well, it's
it's
not that weird because I went for an
it's
endo
just
course in America, in Chicago. I mean, we
yeah.
had Brett on. He opened for us on the
Mhm.
24-hour podcast. And beforehand, I was like, yeah, I like endo. And after a single day, it wasn't practical. It was a lecture
Yeah,
from 9
yeah.
till 5. A 9 till 5 lecture with 1 hour off. I was like, okay, I'm an
Mhm.
endodontist now. In my head, I've not done the qualification, but that's what I am now.
Yeah. You're like that's what I'm doing.
And I did a
Yeah.
similar one the next day, which was the morning, or the day after, which was the morning. And it was composite bond, composite fillings and stuff like that. And I've never been
Yeah.
so bored in my life. No, really. The bit, guess what?
Yeah.
I paid 300 quid for that course. Guess what? The big tip they came out with was pre
What?
wedge.
Pre-wedge? What? Really?
300
Wow.
quid for pre wedge, bro.
I'll give you a free tip now. I like using flowable underneath some of my composites.
What as your first
Get that
layer,
one for free.
or
Yeah, well, I do my bond, and then I like a little, just like a little bit of flow, and then when I finish my composites, if I can give another tip for free, I like to get a micro brush and use a bit of flowable around the margin to sculpt it, because I know some people use bond. I'm not a
are
fan
we
of using
talking
bond
posterior or
there.
anterior?
Just both. I use that as my sculpting. I kind of wet just a tiny bit of a brush with some flow, and I use that to do the margins instead of using bond. You can also get a composite wetting
Hmm.
agent, but don't use bond, because bond is designed for stuff to stick to it. You got staining, and it's just horrible. Just don't do
Yeah.
that, guys. If you
I used to do that because the
so
photograph after Bond looks incredible, and then you need to,
oh yeah, and then you look at you're filling a month later, and you're going, why is it so
yeah, and
yellow?
then you've got
What?
to polish it off, and then it looks okay again.
Yeah,
Um,
that's it.
I use
Uh,
on on the final increment on a posterior one, not on an anterior one because this would be ridiculous, but on a posterior one, I use
yeah.
a number 6 file.
What, a K
Yeah,
file?
for my
What are you doing
anatomy.
with it? Oh, you mean like you'll run it along the edge, right, to get the
No,
terracotta?
no, no, not
Oh
an
no no,
anterior,
just
not
right.
the
Oh
lines.
right, right. For visual
Yeah.
anatomy. That's what I was
No, no, no,
wondering.
not on an anterior, on a
Okay,
posterior. I'll use it there and I'll drag it just where you've got the buckle,
get those
the mesial-buccal
lines. That's a
groove.
nice tip. To
Yes,
try.
you start from the mesial-buccal groove and then you bring it over the corner, and then you take it to the middle, and then you
Mm.
go from the other corner, and then you can use the micro brush, or if you have it an actual, one of the really small proper brushes, and you can just smooth it out a little bit, and then
This is why Panavia is one of my favorite cements, because it comes with those brush handles with the little tip brushes instead of a
Yeah.
micro brush. So I'm always saving those to use for my composites, because you can autoclave the handle and you can just change the
Yeah,
tips.
I got them to get a blue handle with the replaceable tips, which is brilliant. Really, really
Yeah,
cheap, by the way. Really, really cheap.
yeah, cheap,
Quid, couple of quid.
and a lot more environmentally friendly than like 100 micro
Mm,
brushes. Bad.
yeah. So I mean, I use that. I mean, the ends are disposable, unfortunately, but it's better than nothing. What else? What else was I using? I can't remember. It's been so long since I did a composite. What's your bonding technique? What's your favorite bond? Everyone's got.
Me, um, I'm kind of an Optibond guy. I quite like Optibond FL. I know Scotch Bond kind of comes in and out
Mm,
of vogue, but I just like OptiBond. I'm generally more of a selective etch, so I like to etch my enamel first, maybe about 20, 30 seconds, and I'll kind of push the etch into the middle of the tooth. I'm going to do dentine. Usually, if it's a deep one, I'll probably not do too much on the floor, try and avoid too much
mm.
sensitivity there. I like to do 2 layers of bond.
Okay.
So do my first dry it out, and then I'll kind of do a light
Are
second
you
layer,
curing it after you
and then
dry it, or?
usually no, I'm going to cure. I'm going to wait about 10 seconds, then air dry it for another 10, 20 seconds, and then cure it. That's generally the way I would do it. Then I would like a dab of flowable right at the bottom, not like a full layer, just a tiny bit to like smooth things off. I don't know why, but I found since I've started doing it, my I just get like a better seal. It's easier to shape
I
my
always liked an
composite.
SGR, especially on the posterior, just to get a bit of it's self leveling, and then it'll seal
Yeah. Oh yeah.
your margin as well. You know, around the base of your matrix band. I'm getting words now. It's been that long since I've touched anything,
Yeah.
and it would seal your margin around your matrix band. Um,
Yeah, I've not really experimented with biodentine, but I've heard some good things about that stuff
SGR
as
was
well. I'd
nice.
like
Yeah,
to, yeah. So I'd like to look into that at some point. But to be honest, like I don't really have any problems with what I'm using. So that's why
stick with it.
it kind of got to the point. It's kind of now that it works for me, but there's always, like I said, there's always room to improve and look at new
And
techniques.
using Optibond FL, is it the prime then
Yeah,
the two in one?
yeah, prime. Yeah. So it's just etch, prime and bond
Okay,
together.
right.
Yeah,
I was previously doing the
three
three
bottle,
step. Yeah,
3 bottle. So the etch, prime, and then
yeah.
the bond. I mean, from what I hear, it is good, but it's just that extra step. I don't know.
It's one of those. We had the practice I had was really brilliant.
Yeah,
We had it, and I thought, well, it's technically the absolute gold standard, so let's go gold standard.
yeah.
So, um,
I'm very much doubtful about these one ball
oh,
systems. I don't know.
we've
It's like for me, the way I look at it, it's like shampoo and conditioner. Should you mix them together? Like, just have them separate.
no, yeah, it is exactly that, isn't it? Really, um, yeah, guys, if you aren't checking out what bond you're using and what etch you're using, start doing that, please.
Yeah, it does make a difference. There's other good ones,
Oh
like
no, there are,
iBond
but you
as
need to
well.
read the instructions of what you're actually using, which I think a lot of people
Yeah,
don't.
do follow your manufacturer instructions for sure.
Yeah, because I remember one not my ES, the TPD came, and that was the first question he asked, and I was like, I don't know, it's a bond. And since then, it's just
Yeah,
like,
right? It's like glue,
good,
right? You just
good
stick it
point.
on
I
and
was using it correctly, thankfully, because it was the same one that I used in uni, but I didn't actually know. I was just doing it because that's what we did.
yeah.
So,
There's things like even like with Panavia that sometimes it recommends that you use etch if you look at the cards, and people are like, "What?"
mm,
I'm like, "What do you mean you don't know?" Like, the etch isn't in the kit. I was like, "Have you read the instructions?"
yeah, yeah. It's one of those. It's like people try and build furniture without actually having looked at the pamphlet or whatever, and then you realize, oh crap, there was supposed to be like a shelf in there. It's like a box that you've not opened yet.
Yeah, I don't get it. Maybe it's like part of the challenge. It's part of the fun.
Then you have to break it all up, especially if you start using something like glue.
Yeah.
Then you're done.
Oh yeah.
Yeah,
Then you're done. You just got to give up.
yeah. Um, I was going to ask you, your scanner, does it show you the occlusal
Yeah.
loading areas? Because apparently the itero will show you areas of high
Yeah.
stress.
It doesn't really show. Well, maybe it does. I've not really looked at it, but I've not used that feature myself. If it does, but the ones that I would mainly use are the wear over time, and I love seeing the level of contact and space
Mm.
between teeth, because I obviously more of a restorative guy. So those are the main things that I would use. I know the newer ones have like things like caries detection, which I think is awesome.
Yeah, it does sound interesting, this caries detection thing, but I'm not sure how
I've,
accurate.
I've not seen the space areas. I'm not sure how
Mm.
that would work.
I wonder if they're doing something with density, maybe.
Yeah, it might be similar to the caries one,
Yeah,
but yeah, I do you know what I love though is just doing the prep and literally straight away you're looking at the scanner being like, what's my reduction? Am I there or not? And if not, you just pick up your handpiece, you take a sliver off, and then you rescan it, and it's perfect. It's you don't even have to do the whole scanner. That this is the thing, right? If you do an imp and then you're looking at the bite and it's not quite right, something's gone wrong, you've got a drag, you have to do the whole damn thing
yeah.
again. With a scanner, you just delete it and rescan that bit.
Yeah,
It's
it
it's so
changes because you can, again, it's like taking that photograph. You can instantly evaluate what you've done without actually having to make a mistake and send something to the lab
mhm,
and paying 100 quid for a crown to be made. And then that's
right.
not gonna, if it comes back not right, that's not gonna come out the patient's.
Or yeah, the lab writes you and they go, "What are you doing? You've given me half a mil of occlusal, right?" And you go, "I'm sure it was more.
It
Like
was two
that
and a
can't be
half. What are
me.
you
It
on
must
about?
have." Yeah, 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 right. And you just have to like re-prep the tooth, but you know that straight
Hmm.
away. So stuff like that's awesome. But the thing I'm struggling with emotionally right now is I don't know if you're much of a computer geek guy, but Nvidia have just released these new graphics cards, right? The 3000
Right. Well,
series.
I'm an Apple guy, so
And
I don't need to.
are
Yeah.
you an Apple guy? Oh, and I have a computer that I use for work. And I had the Titan, and now I know that there's a new graphics card that's coming out that is significantly better than the one that I have. But I also know that the one that I have is more than sufficient for the work that I do. But just that knowing that there's a better one out there is just really bugging me.
Yeah, I can feel you with that because I'm always looking at the Mac Pro, the
Yeah.
the cylinder. I'm going, oh, I wonder how
Mm.
fast my stream would be if I used that. Like, I wonder, could I use an 8K camera if I had that? Or something stupid.
Right.
Thankfully, I can't afford it, so we're not going to find out anytime soon. Um, and
Well, from what I hear, even the wheels on that thing are pretty expensive.
yeah. Oh my god, there's ones that cost as much as like Maybachs and stuff. In fact, let me do the search now. I'm going to go on the Apple website. Let's guess how much it actually scores.
If you got everything at
Yeah,
the
yeah.
top tier, I want to say it's at least 70K. Knowing Apple, at least 70 grand you could easily spend on a top of the range
But I
Mac.
reckon these are the ones that you can actually use if you wanted to do, movie level graphic design and like all that
Yeah.
stuff. Right? So where is it? Mac Pro. Oh my god, it looks like. Do you know when you watch a film and they've got the briefcase with the nuclear codes in it? That's what it looks
Yeah.
like. that's that's literally what it looks like. Let me go to the bottom now. I'm gonna click. I'm not gonna click buy. Or do I have to click buy? All right,
Wow.
live
You're gonna.
research here. We've gone completely off topic, but that's the whole point. So Mac Pro.
I've never been convinced by the Apple ecosystem. I don't know why. I had an iPhone for about 2 years, and then I just love the customization options with Android, and I think that's one of the reasons I've never really got into. I think if I was an iPhone guy, I would have just got into that ecosystem.
The iPhone was the absolute last thing that I was into. I didn't like faffing around with Windows. It really, really annoyed me. And every
Yeah,
Windows computer I bought, because I never self-built because that's just too much effort. My friend self-built and his was brilliant, but I couldn't be bothered self-build. They just died after 18 months, every single one. The iMac that
yeah,
I bought in 2015 is still going perfectly strong. Zero
yeah,
indication of any slowdown. The only reason I've had to
yeah,
buy a new laptop is like I said before, my car got broken into and I got a bunch of stuff stolen. That's the only reason I've changed my MacBook. And it's the Pro one. I had the Air before, which my brother now uses. So that's been going 8 years. You just don't have to,
Yeah,
unless you literally
my
have to change.
brother-in-law's got an iMac, and he's had it like 8 years, and he loves it. And it just goes forever. But I'm the kind of guy who'd still be upgrading every 2 years, even if it did work. I'd still be like, I need the new
Yeah,
one.
all right, we've got a final price. What do you reckon?
I'm going 70,000.
So
So,
we're at 53,548 pounds.
ooh,
That's pretty heavy.
that I mean, that's a significant. That's like a practice investment right
Yeah,
there.
I wonder whether you need it.
What could you possibly do in it that you couldn't do with like say like a £10,000 Mac, right? Like that's not
Mm,
cheap either.
I don't know. I, don't, I would have to. Maybe I'll ask him next time I go to an Apple store.
Farm some like Bitcoin or something. I don't know.
It must be the really really high end stuff. Actual. Like
Yeah,
I don't know, maybe high end architects or something like that. Where they're doing really
yeah,
crazy stuff with skyscrapers and stuff. I don't know. So
yeah.
it looks cool though. Sure.
Yeah, it does look cool.
Yeah, but they don't die.
I think that's one of those ones that's like more of like a statement than
And you need this.
than a work thing, right? That's just that I have this
You
because
wouldn't
I
want to tell anyone because if you gets nicked, it's gonna be like, oh crap.
can. Yeah, that's true. You feel like the Google CEO or something, well, probably not the Google CEO, but like some tech company CEO just has one, in his Silicon Valley flat because he
Yeah,
loves it.
I mean, it kind of makes sense for those guys because they probably earn that after every 30 seconds or something. So fair
Yeah,
enough.
that's
Yeah,
true.
no, the tech side of dentistry is just ridiculous. I'm really obsessed with the tech side now, like guided surgery, guided endo, guided just this and that, and then scanning everything. I just don't like.
Well, what? I've always said that I love my video games, and I feel like they have helped me a lot currently in my current job. Maybe not
Yeah.
4 years ago, but now when I'm looking at stuff and I'm like, you kind of get that skill of being able to visualize something that's outside of your hands, outside of something that you're seeing directly on the screen, and you can translate that into a mouth, right? Like you can kind of work around things, and you'll find that you'll be able to intuit control for 3D programs and software design and all this kind of stuff a lot quicker if you're used to using computers, if you're used to doing something with your hands and something different happening on a screen. So stuff like that is actually very useful. I never thought it would be useful growing up, but
Why is my sign flashing?
oh, nice, it's gone disco.
Weird. Did I press something? I wonder if I stood on the.
Oh,
I
it
just
stopped.
unplugged it again. Very weird.
Oh, it's back.
I don't know.
Have you synced your sign up to when some football team
No,
scores?
it's just
I see that's a thing.
that's weird. I'm gonna plug it into this one. It shouldn't do that.
The good vibe sign.
We're back.
It's having its own
I think
vibes.
maybe that particular plug socket I had it in wasn't a very good one. I just changed it. Yeah, no, I forgot what I was talking about now.
Well, I was just saying, the like your hobbies, your digital side. If you're into digital technology, there's no reason that can't translate into your work life, right? Like if you like taking good photographs, if you're into your photography, that's a useful skill to have for
Mm,
dentistry. If you like 3D modeling, 3D design, you like technology, you like social media, that's also useful for work. So it's not just the clinical side, and that's not the only part of dentistry. There's a lot of different aspects that people can get into and people can enjoy.
yeah, yeah, definitely. Because I feel
So
like I'm more creative than sometimes dentistry. Excuse me. Than dentistry allows you to be, because
hmm,
there's things like if you've seen the video that I did for the promo for the Hopper podcast where I had the things coming in and out and the bit of music
yeah,
behind it, and I actually had the music on TikTok because I couldn't find anything else. But but that kind of thing, you don't really have the opportunity to do that within the surgery so much. And then I have knowledge of social media, so I've been doing one-on-ones with people who are trying to get people in the door, or there's Mind Ninja with
yeah,
Maru. uh Maru.
mhm,
I always get say it wrong. It's like Sharu, but Maru. Yeah. Um,
yeah,
So she's trying to get people to come in and help her out and sign up to her courses and stuff like that. So that's been something we're doing as well. So kind of marketing is really interesting because it's all about psychology of people, which is so
Yeah.
cool. And I can tie in photography
Yeah,
with that.
I didn't realize how important Google Analytics are when it comes to the business side, and how to get your message out, how to get patients to understand what you can
Mm,
actually do. It's huge, and I feel like a lot of dentists who don't do it are missing a big trick. And it's yeah, it's we live in the digital age, and if you're not paying attention to social media and to Google, then you're going to be falling behind in some aspects. So it's all part of thing. And they don't teach you anything about this at
no,
university.
I mean,
Like, they don't even give you an inkling this
well,
is
I don't think
important.
they know because they're just
Yeah, this
they're,
is it. I've always said that. So a lot of the people who are at the hospitals, right, or the teaching, they are academically unbelievable. But when it comes to their communication and people skills, it's kind of like that's not what they're
yeah,
there for. And I'm generalizing because I know there's people who are good at
yeah.
this, but it should be part of the curriculum, like the total like the overall view of dentistry and how it works. And I don't know, they seem to just pretend that dentistry doesn't have a like building up your reputation, building up yourself and your clinic. They don't really discuss that with you at all. And I think that's why a lot of young dentists, when they come out, they come into this big world of complex dentistry, seeing all these these big dentists doing all these procedures. They don't really understand how you even get there. They can't even comprehend the route to get to that point. I think that's why some people
I
get
think yeah, I
disheartened.
think you get this safe beginner thing, which you kind of understand as you go into dental school anyway. You get it hammered in, and they never give you any inclination of what the next step should be or could be. Beyond, all right, yeah, you do your FD and then you go get yourself a UDA job, but that's because all these universities are funded by the NHS. So why are they going
Yeah.
to tell you any different? And I think that's where things like BAPD have been really good and showing people another way or
Mhm.
how to do things. Simon Shah's been
Yeah, yeah.
brilliant for people who speak to him. I know Shiraz is another one, and there's more guys out there
Yeah.
like that who are giving their time away to show you how to do things. So um, I think you're probably right. It probably comes from the academics only thinking about academics and they're not thinking about real world because they've never had to do any of it.
Mhm. Yeah.
Mm,
So, and I think that's one of the reasons I got into the teaching, is to kind of show the younger dentists there's different ways available. But to be honest, I still do a little bit of NHS. I don't know. I've always kept on my NHS contract. Not for that many UDAs, but I like. I don't know. I just enjoy seeing my NHS patients as well. I think for me, it's part of it's about giving back a
yeah,
little
giving
bit
back's
to the system.
super important, isn't it? I think gives you that satisfaction.
Uh, although some days you do get some patients that you're just thinking, you're putting so much effort in and you don't even appreciate it. But that's just
Yeah,
life.
I think that's something I've really
What can
struggled
you do?
with, to be honest, because I had this idea in my head that there's all these other things that I want to do, and why am I stuck here with people who I tell them all the right things and then they just go off and do the opposite,
Yeah.
and then go, well, yeah.
Yeah.
So I think that's
That's it.
I mean that's on my personal sort of side because that's kind of how I felt. Other people are going to feel differently. I think it's important to give back, well, in some way. I don't think you can always go after stuff for yourself. So I think it's really important to do
Yeah.
that some way, whether that's going on the mission trips with RCF or doing NHS, which is almost a charity, but charity as it is, to be honest. I would say
I think that's something I've heard a few dentists say, that making a denture on the NHS is borderline
in a
borderline
way
charity, but
it costs. It really does. God, if you have to,
the appointment time, the lab bill,
if you're
and
doing an upper and a
it's
low, oh god, that
yeah,
it all. And I think part of it is,
that's
I
it.
think if you were to give the patient a bill at the end of the day, even
Mhm.
if it just says your contribution 69 in it, and they saw the actual cost, they'd be like, oh
Yeah,
wow. And then because not
yeah,
much of it goes to the dentist. I tried to explain this to someone the other day who was working
yeah.
in the States, like one of my friends, and he goes, oh yeah, so we charge like 200 for a composite. I was like, on
Mhm.
insurance. He's like, yeah, so our version of insurance is NHS. We get 30
Yeah.
quid for all of them. And he was like,
Yeah, I know,
he was
right?
like,
They
but
can't
why?
comprehend. Yeah. And you go, I don't know. I don't know. I just do it because I
People
have
keep
to.
pointing Tory. That's why. Um,
Yeah, that's it.
yeah, and they're shocked, and you kind of that's I think part of the my problem is because I speak to so many of these guys. I'm like going, I'm not doing it anymore. No,
Yeah.
I value I value myself higher. Um, but I think it's important because dentistry has an area. It has that area of self-esteem where a lot of dentists are struggling with their mental health and all that kind of thing. So if you're doing that at the same time, you're devaluing the work you're doing. I'm not surprised that we've got such an
Yeah.
issue with mental health. It is what it is, right?
Yeah. No, it is what it is. But for me, I think the system as it is at the end of the day, there's people that
Yeah.
need seeing, and not everybody can afford
No,
private
that's for
dentistry,
sure.
right? So, the dentistry very much has a place in the NHS, but I think that the way the system works is it punishes the best of us, right? Because the most ethical, the most conscientious dentists who do everything the correct way, and they make a point of doing things to the best of their
Don't
quality.
cut
They're not worried
corners.
about the pay.
Yeah.
They just go, they don't cut corners. They just do it correct. They're making less money than the people who will cut more corners, who will fudge the boundaries. They'll do things a bit more gray areas. So how can a system that punishes our best dentists and rewards the people who are a bit more morally gray, how can that make sense, right? I've always thought that if we can stick to having a basic NHS system, the funding realistically, it only really funds about half the people it says it funds, right? The funding's only
Quarter
for about
maybe
half the population, maybe a quarter to
for
a half, right?
comprehensive dentistry.
Like
Yeah.
for comprehensive dentistry. So then do you just say, look, do we stick to a basic emergency service, like maybe like extractions, some fills and things, and then if people want more advanced stuff, you say, look, maybe offer it independently, and then more people can be seen, you get access, you're not hearing about these people who just cannot get an
Mm,
NHS dentist because, then you can prioritize the more urgent things, right? Um, but at the end of the day, the government want the maximum amount of people being treated for the minimum amount of money. That's just how it works. That's health economics,
yeah.
right?
Unfortunately, yeah.
And and something's got to give at some point. But the system for me, it just doesn't make sense. It just doesn't
Yeah,
work.
I
It's
think there's
complete.
going to be more and more people like myself, maybe very slowly, more people like myself who just just walk and decide, my
Yeah,
mental health is so much better now that I know that I don't have a target, and when I go into a job, it's
yeah,
going to be however hard I work is what I earn, as opposed to I now have this horrible number looming over me, and I'm not dividing
yeah.
5,500 by the number of weeks left anymore.
But yeah, literally. Do you know what the thing is that yeah, I'm at that point as well where my target now, uh, I've got like 8 years more experience, but 8 years ago I was doing twice the amount of UDAs. And now I'm like, why
Yeah,
was I doing that? Why was I so desperate to get more UDAs? Like, now whenever somebody comes to the practice, I'm like, do you want some UDAs? Just have some more UDAs. I don't want them. You take them.
yeah. And it's one of those like I wanted to spend more time doing my root canals, or I wanted to get some private fillings in,
Right.
and then you go, oh hold on, I'm now down 10 UDAs a day over where I was a month ago because I've spent some extra time selling some composite fillings.
Yeah.
That was a bad idea. So
Right.
where's
Like,
your balance?
yeah. I mean, for me, I enjoy sitting in with like some of the other dentists and just doing teaching with them. And like, I don't know. I think I'm at that point where I'm not bothered if I'm doing the clinic
Mm.
myself or if I'm just observing someone
You're a
and
full
taking
time
time out of
chiller.
my
That's what it
diary.
is.
It's just I'm now a full time chiller. I spent like 8 years just on that grind, and now I'm just like I just want to enjoy my life, my dentistry. So yeah, I'm dropping a day, doing more teaching, and you kind of get to that point where it's not sustainable long term, as you said, physical health, mental health. It all starts to it starts to go
Mm.
for sure. Um, and I actually think for me the lockdown was there's obviously a lot of negatives, but I found the break from dentistry was amazing. I think I really
You
needed
get to
it
recenter, don't
just
you?
to have
You get to recenter where you're at.
yeah, just recenter, reset, and figure out what it is you want to be doing. Um, And apparently for me, that's dropping a day to focus more on
Mm.
teaching, focus more on my implants. You know, if I've got a big case, I'm not having to like squeeze them in, being like, oh, when can I do it? It's got to be 3 weeks. Now I'm like, oh, I'm not working Fridays. I can just come
Just
in on
do it then.
Friday,
Yeah.
right? Just do it then. I've got flexibility for my patients. I've got flexibility for my nurses to look after things, you know, do paperwork, manage my patients, follow up on things, instead of them having to try and be stressed and do it between patients.
Is dentistry your source
So
of income, or have you got to the point where you've taken that load off? Because I think that's where a lot of people come into their own with dentistry, is when they've been a bit clever during the first few years and they've made some clever sort of moves.
yeah,
You know, maybe you staying at home for a long time, doing some clever investments,
mhm,
bought the house outright, for example, and then, you
yeah,
know, maybe renting something else. So now when you go to work, there's no, oh God, I have to earn money.
yeah, yeah. So basically, yeah, I think I'm at a point where, like, if I'm not like, oh, I need to be doing 6 days a week to make enough money to get by. Now I'm, you know, I'm quite comfortable and got some savings, got some business and things. So you gotta decide, right? Are you gonna just be someone's associate for the rest of your life,
Yeah.
which is fine. It can work in some cases. Or do you want to get into practice management, practice ownership, right? So there's two different ways of doing that, and that's a decision that you want to make because there's headaches to go with
Yeah, for
practice
sure.
ownership, partnerships, and they are, but then they, but it can work out financially long term if you look at it as an investment as well. So that's a route that people don't really, they get very comfortable as well.
Yeah, that's part
So
of it, because you get into this is my daily routine and it's hard to disrupt that.
mhm. No, for sure, for sure. So I'm just looking at the time, so I'll probably have to make
Oh
a little
yeah, no,
move soon.
it's been great having you on.
Hmm.
I think we've explored a lot of really interesting things. I'm sure we'll get you back
Yeah,
on soon. Um,
no, it works.
where can we find you? We can find you on Instagram at
Yeah,
dr.ali altaf. Anyone who wants to find
that's
out
it.
more about Refugee Crisis Foundation, head over to the website, Facebook, Instagram. You guys
Mhm.
on Twitter?
I'm not sure if we're on Twitter. Uh, I'm not a Twitter guy. I'm not a. I think Donald Trump's ruined Twitter for me.
I'm trying to work out Twitter, because I feel like I could be good on Twitter, but I think you have to be more outspoken and outrageous than I currently am. I'm trying to be funny at the moment. It's not really working
Yeah,
for me, so I might have to be
is
more
it?
antagonistic.
You could take like the Trump approach and be like UDA sad. Like-
Yeah, we'll see how it goes. Um, but yeah, guys, big thank you to Ali for coming on.
No, no, I appreciate it. I appreciate the support that you've shown the charity, and the donations that everyone's made have been huge. It's been making a big difference at the camp. It's letting us keep doing what we're doing, which is provide dentistry to people who need it
mm,
most. Um, so the support is just, it's fantastic. So I'm looking forward to the videography, and I'm hoping once the lockdown starts to ease, we need to do like, you know, like a chicken wing challenge or something somewhere awesome in Manchester. I think that's like for me on the cards, or some like nice ribs. Take
let's
some good Instagram videos and food.
let's put a mark in the diary once once coronavirus lets us go out and properly and stuff. But
That's
that'll be
it.
for sure. Thank you to everyone who's joined us on the live stream. Please, if you're new, hit the like button, leave a comment, let me know what you thought of the stuff we spoke about. Any questions from me or Ali, get them down below. Have I said subscribe? I didn't say subscribe yet. Do that. Hit the
Yep.
notification bell. That's also good. Future videos that we've got coming out. Instagram for Dentist series, where I go through stuff that you guys can do to implement in your Instagrams to up the level and quality. If you want one-on-one training, I've been doing that as well. If you want to help out with more stuff, which helps the quality of the streams and stuff, which I've been very grateful for, head over to the Patreon group. We've got good number of guys in there. It's good fun, good chat. It's almost like a support group in a way. We go through a lot of the things that we spoke about, you know, case discussion, people sending different studies around, so it's quite good in there as well. And it helps me kind of take this whole podcast to the next level. So that's what you can do if you want to help out there. In fact, guys, if you haven't already seen it, go back to the podcast I did with Nat Bradley. I've just thrown up quick short clip of it today, and then skip back across to this and see if you can notice the difference in sound quality and video quality on my end. Because I think the guys in the Patreon group have done me a big solid in supporting me and helping me out with the equipment side of things. So big thank you to those guys. Ali, let's end the stream there. Been great having you on.
No, thanks for inviting me. Always a good chat, and we always seem to talk about just technology, which I love.
We're a podcast about dentists, not about dentistry, actually, so it fits in perfectly.
Yeah, that's true. I think the next time we need to discuss food more, because that's my other my thing that I absolutely love.
Yeah.
I love cooking, and I love.
Have you enjoyed my cooking videos recently?
Are you making cooking? I've not
I'll
seen
show
any.
you them afterwards.
Oh, I need to follow. Oh yeah, send me some for
All right.
sure. But I think that's what I'm missing most about lockdown, just getting out and eating.